My name is Aurelia. Today I'm going to examine my patient, Dr. Abel, that came in with shortness of breath and then chest pain. So we've done the history taking, and then we are going to do the physical examination. So the examination we're going to do just now is called the respiratory examination. Okay. Hi, Dr. Abel. My name is Aurelia. I'm one of the AMPs. So I've been asked to examine your chest because you came in with shortness of breath and chest pain. Are you happy for me to go ahead?
Absolutely.
Can you please confirm your name and your date of birth, please?
My name is Mr. Abel, 210678.
All right, so that's fine. I've got consent, and I'm going to do what I call the infection control. So you do infection control at every point in time, beginning and after every examination. So now I'm going to do what I call the general inspection. So the general inspection I'm going to do, basically, I am looking for signs of respiratory distress. At this point in time, there's no oxygen, there's no inhaler around us to show that there's no signs of external devices that is being used. Are you comfortable just now?
Yes, please.
Yeah, that's fine. So patient seems to be comfortable at rest just now, and I'm going to do what I call the palpitation as well. So for the palpitation, I'll be looking for chest expansion. Is that okay? So for your chest expansion, can I ask you, before I do that, I will do the further general inspections I will do is by checking your hands, your eyes, and so on, okay? Can I ask you to bring your hands forward? Okay, open your hands for me, please. So I am looking for nicotine stain, tar staining, and other peripheral edema, but there is none here. Sinuses. Can I ask you to put your hands this way? Okay. Then can you push your hand like this? Okay. So I am looking for tar staining, evidence of CO2 retention, which there is none. Relax your hand. So I'm going to check his body temperature as well, and so while I'm doing that as well, I will check his pulse. While I'm checking for his pulse, I'll be checking for his reps as well. So he doesn't know I'm checking his reps, but if he does know, it's going to change the rhythm, the breathing pattern, which I don't want. So his pulse seems regular, so it's 16 at the moment, and his reps is 14. His reps is 14, and his pulse rhythm and volume seems okay. So now I'm going to check his oxygen level. So I've not got my equipment here, but I'll check your oxygen level here, and then I will be checking your temperature as well. Just pop your hands for me, please. Thank you. So we're checking your temperature. So my patient's temperature is 36.4, which is normal at room temperature, and his oxygen level, I've just checked, is 96%. Okay, so I'm just checking his blood pressure just now, okay, and his heart rate. So while I'm doing that, I'm going to be checking his eyes as well. Open your eyes for me, please. So I've checked the eyes. There's no evidence of conjunctival pallor, and then there's no evidence of sinuses. There's no redness. There's no dryness. There's no. Can I ask you to open your mouth for me, please? Now take your tongue to the roof of your mouth. That's it. So there's no signs of dehydration. There's no signs of anemia on my patient. So I've just checked his blood pressure. His blood pressure is 128 over systolic over 81 diastolic, and his heart rate is 83%, which is normal for a patient, for a normal patient. So now I'm going to check what I call the palpitation. So for this, I will be checking your chest expansion as well, and I will also check your trachea position, chest expansion, and the volume of your free-matosis. Okay. So can I ask you to breathe in and out, please? Okay, so that's fine. In, out, in. That's fine. So his chest expansion is equal, and I'm going to check his trachea as well. So for the trachea, if you just I'm going to check, it's quite uncomfortable, but if you're sore, just let me know, okay? So I'm just going to put my middle finger here and make sure the trachea is central. So there's no deviation of his trachea. It's quite central. So I'll just come down here, and that's fine. So he has done the breathing and out. So I'm going to be checking for your lymph nodes as well, okay? That's okay. So normally you are meant to sit up, and I'll do this from behind, but yeah, that's fine. Okay, so everything looks fine. So everything looks fine. Can I ask you to look that way so I can check your JVP? No, if you just relax, relax. Then you look that way. Okay, so I am looking for the JVP to see if it's normal or is reduced or raised. So its JVP is around at this angle. So for you to see the JVP properly, you can actually press. I'm going to press your tummy if that's okay to see the JVP properly. It's all right. So I've just done that so you can see that it's nice and okay. So it's not go. That's fine. So you can just stay normal. So I've just checked his JVP as well, so that looks okay. So I'm going to do what I call the percussion just now. All right, so for this one I am comparing both sides, and then I will percuse symmetrically. So for this one you will please bear with me, okay? Is that okay? So okay, so that looks normal. So resonance simply means normal, and when you hear something that is dull, that means a possible pneumothorax effusion. Or if it's something that is hyper, then you're talking about like pneumothorax, but in this case it's normal here, and I'm going to be doing what I call the auscultation. Okay, so if you just take a deep breath for me with your mouth, please, in and out. No, just yeah, okay, that's fine. So breathe in and out, please. You keep doing that, please. So that your breath, your sounds looks quite resonant. And if you just say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, thank you. So if I ask you to sit up and fold your hands together, so I can just check your do the same thing at the back as well. So if you just face this angle, is that okay? Thank you. So at this point in time, I know I'm backing you, but at this point in time, I'm going to be looking at the physical inspection as well. So yeah, I'm looking for signs of respiratory distress and any scars. There's no scars here. So I will go straight to palpitation. So if you just breathe in and out, please. So I'm checking for the chest expansion. And again. One more time. So I'll be doing what I call the percussion. For the percussion, I'm going to be comparing both sides, if that's okay. At the count of okay. So I will be doing what I call the auscultation. So if you just breathe in and out with your mouth, please, for me. Take a deep breath through your mouth. So I'm listening for the anterior and the posterior. Okay. So his breathing is vesical. Okay, at this point, and I'm going to be doing what I call to check the resonance sounds. Okay. So if you just say 99 for me.
99, 99, 99, 99, 99, 99, 99. 99.
Okay, that's fine. So if you sit lie back properly, please, if that's okay. So at this point in time, I will examine your hands again. So I'll be looking for clubbing here. So if you just put your hands for me like this, please. So now I'm looking for the ankle. I've checked the ankle previously. I'll look for the I'll take your trousers up as well. So if you just put your hands like this, do exactly what I've done. No, look at what I've done. If you do like this, okay. So I'm looking for that tiny window, so it's not got any clubbing. Okay, that's absolutely fine. Thank you very much. So there's no clubbing here, and I'm going to be checking for I'll check his pulse in his ankle. There's no evidence of sinuses on his hands as well. and there's no evidence of clubbing, and then his pulse seems regular. So I'm going to check your, there's no peripheral edema as well. So the last but not the least, if you just sit up on the bed, I will just check your back. So what I'm going to check here is just for peripheral edema. So there's no evidence. So just with your 3 fingers, you check down lower is lower back. So there's no peripheral edema. So that completes our examination, Dr. Abel. And if you just get dressed just now, and I will come up with the findings. Is that okay? Thank you very much for watching. And to complete this examination, I'm just going to do infection control as well. Thank you as you get dressed, Dr. Abel. Thank you.